Doc on the Run. We help injured runners run. A few days ago, I was doing a phone consultation for a patient who had a fracture in his fifth metatarsal bone. I was trying to help him understand how important it is to reduce inflammation to speed healing. During our call, he asked a great question. Should I wear compression socks if I have a running injury? Whether you have a metatarsal stress fracture from running a little too much, or you rolled your ankle while running on a trail and got an avulsion fracture of the fifth metatarsal bone, your foot can swell up like a balloon. Now, a hot air balloon may be a beautiful form of transportation, but it certainly isn't the most efficient. And although the inflammatory process that produces swelling is supposed to help you heal, you won't heal as quickly if your foot is swollen and blown up like a balloon. You have to deflate that balloon and remove the swelling before you can make progress. The inflammatory phase is the first phase of wound healing. That's where you get pain, swelling, redness, and all the initial outward signs of injury. That initial phase is supposed to deliver all the cells to the area of the injury to remove debris and start the healing process. But as a runner, the part you're most interested in is the proliferative phase. During the proliferative phase of wound healing, you get new collagen forming, which helps bind structures together and stabilize them. You can't move broken pieces and expect them to heal. You have to have stability before you can start motion. Obviously, it follows that if you want to heal and start running as quickly as possible, you have to get that injured tissue stable enough so that it can handle early range of motion and then progress to more aggressive, more stressful activities like running. Applying compression to help push out the inflammation makes a lot of sense. Emergency room physicians and athletic trainers have been applying elastic ACE wraps to sprained feet and ankles for decades. The problem with elastic compressive bandages like this is that they're very technician dependent. If you apply them with the wrong technique, you can actually wrap one section too tight and create a tourniquet-like effect. If that happens, you can actually wind up with more swelling in your foot than if you had no compression at all. I have seen injured runners, medical students, nurses, and even doctors wrap ankles incorrectly with an ACE wrap. And the truth is, it's easy to get it wrong. I often talk about compression socks and recommend them to runners to help reduce inflammation after an injury. In most cases, I think compression socks are much more effective than many other forms of compression like elastic compression wraps simply because they're more reliable and can provide much more even, consistent compression. But there are some cases where compression socks can do more damage and actually slow down the healing process. Some of it has to do with the specific injury, but some of it has to do with the timing. Let me give you an example. Let's talk about second metatarsal stress fractures, which may be one of the most common overtraining injuries among runners. A stress fracture is a broad term. Stress fractures come in a whole range of trouble. In the very earliest phases, even though we call it a stress fracture, the bone isn't actually broken. More appropriate term is a stress reaction. In this case, the bone is irritated and somewhat inflamed. There's no actual crack in the cortex or outer shell of the bone. Now, because the metatarsal bone isn't actually cracked or truly broken, it's very stable. It's just sore. Basically, it's swollen. Granted, the swelling is inside the bone, but it's still just a problem of inflammation. It's a problem of swelling. If you have a stress reaction and this type of metatarsal stress fracture, wearing compression socks makes a lot of sense. The compression socks will help push out that excess inflammatory fluid. Getting the fluid out will speed up the healing process. The bone is stable. You can put a sock on and you can pull them off without any further risk of injury. Now, at the other end of the stress fracture spectrum is what we call a pathologic fracture. And a pathologic fracture is one that's broken in two. Pathologic fracture is the one that most people visualize when we say someone has a broken bone. If you look at the x-ray of this type of metatarsal, you can see an obvious fracture line where the bone has been broken into two distinct pieces. These types of metatarsal fractures are unstable. If you just touch it, it can move, and that hurts. Now, compression socks, because they squeeze, they're very, very tight. Now, it actually takes a lot of effort and even special technique to get the socks onto your foot, over your heel, and up over your ankle and leg. If you try to shove your foot into compression socks and you have an unstable metatarsal stress fracture like a pathologic fracture, you're most likely going to be moving the end of that broken bone. Moving a broken bone will never make it heal faster. If you have a stress fracture that you ignored and continued running on it until your foot was black and blue, bruised and swollen, you actually developed a completely broken metatarsal bone, wearing compression socks makes no sense. Well, actually, let me rephrase that. Wearing compression socks makes sense, but putting the socks on is more likely to cause injury. Unfortunately, you just can't get the socks on without jamming your foot into them and potentially injuring that unstable metatarsal bone. Somewhere in between these two extremes is what most runners think of as a metatarsal stress fracture. It's where you ran a little too far, you stressed the metatarsal a little too much, and it developed a teeny tiny, virtually invisible little crack in the bone. Although there is actually a crack in the bone, it takes a lot of force to actually bend the metatarsal bone enough to cause pain. So it takes a lot of force to actually bend the bone enough to make that little crack any bigger. Doc on the Run. We help injured runners run.